Oh, sorry. Yes, I just checked it. Okay. The key content. So the key content, you can add the last key content. So see, show key content. If you have a news and events, as I mentioned before, you have you can add it to our GNC website. You just add it. For example, webinar on submission. You just write and it will be appear. Once you add the news, you just search about it and it will show directly. It will show. You just select and it will be appear like this. So this is, I mean, if you add any news or event, it will be added directly to GNC website, GNC home page. So it will be also on the home page of the GNC like this. Also, it will be shared with our email list in weekly newsletter. So this is, you can add just the 3. So the recently last 3 news or event, you can add it to your webpage. If you don't have, for example, you can just say, I don't have until now, don't show key content. So it will be disappear. So we come up next to the media report. From here, we start the reporting. So the first one, nutrition project in the 2020 GHRP. So if you have this information, as I mentioned, it is more flexible. You just click show. If you don't have it, just hide it, remove these things. Okay. So what you will find here, you can remove it also, and you can add to 5. So number of projects, UN project. We know that in HRB that we have OBS system that you can know number of UN project, number of local NGOs project, international NGOs project, and standalone intervention project. So you just add it like this. We will prepare it for you. If you have it, just add the numbers. If you don't have anything, you can hide or you can remove. If you don't have any projects until now, you just remove the things you don't have. For example, if you don't have international NGOs, you just remove it and you keep others. So this is the nutrition project in the 2020 GHRP. Now we come up to narrative analysis. So we have these things. We have situation analysis, response, strategy, challenge, main challenge related to COVID, and priorities. If you can see, once you click, it is expanded. Okay, so you can write here about your response strategy. How is it? The challenge you face during this period between January to June 2020, all this information. So main challenge related to COVID, you can list it there. Also priorities for the next 6 months. So we will prepare it for you also this thing. How you do it in the back end, you just come here, you just write in the text below the title, and it will be appear in your page. So this is back to, anyone have question, he can write in the chat box, and Magnat after that can summarize the question. Thank you. Okay, key figures in 2020. So the key figures here we have BIN, that means people in need, target, and reach. So this is the totals. The total of people in need for this country, the total of target, the total of reach. So you can add it like this. And the funding also required, the amount you require, received, this is the amount, and met. And you can use OCHA FTS funding tracking system to find this information sometimes if you don't have it. How you do it in the backend, it is just very easy. The color, it is fixed for all countries, so it is GNC standard. So you just, in the people in need, you can add these figures. Just to mention one point, that every figures, that's mean in million. This is millions, that's mean 180 millions. That's one is 1 million.19. thousand. So it is every figures, it is in million, just to mention. Now we come up to the nutrition indicators. We have some blanket supplementary feeding, vitamin A, also micronutrient. If you are working in any one of these indicator, you can report it, please. Also, in pregnant lactating woman, we have this. All of this indicator will have the full name. Now we will change it like this. But what is it? For example, for pregnant lactating woman, you will have IYCF counseling, BLW, MAM, blanket supplementary feeding for pregnant lactating woman. And also we add this one related to COVID, number of caregiver of children less than 2 years, all who were reached with message on breastfeeding, young child feeding or healthy diet in the context of COVID through national communication campaign. So also in the back end, you come up here, you will find this is the tab 1, it is for children. The tab 2, it is for pregnant lactating. So you will find here SAM. So you will enter people in need, target, and reach. If you don't have this figure, just for now, you can keep it 0, 0, 0. After that, we will see. We can remove it, or we can ask you if you have another indicator. So you can just keep it 0, 0, 0 if you don't have any intervention. So this is for MAM, also children, blanket supplementary feeding, and vitamin A. We will add micronutrient for you. Also on tab 2, you can find this for pregnant lactating woman. Tab 2 is yes for BLW. So you will find IYCF counseling. So here, people in need, you just write the numbers in the value. This is the target, and this is the reach. Also, BLW MAM, the same things, and other the same things. You can find this also for COVID. If you have more, you can add. If you click add bar chart, for example, you have another indicator, you just write the name of the indicator here, and the people in need, target, reach, and you enter the figures. If you don't have, you can just remove it. It is very flexible. So now this is not yet in the front end page for COVID. So this is the figures. After that, we come up to the COVID guidelines. So this is as a question for you. You know that in GNC, for example, this is nutrition management surveillance. For example, this one, this is the guidelines. You can answer this question. Are you aware of this guidance? Has your cluster sector used it in your country context? So, and two narrative things, you just let us know what are the challenge in implementation this guidance in your country, and what specific support do you need from GNC in implementing this guidance. So you can write for us this information for each guidelines. So you can find it everyone here, the title of this guideline. So it is the same answer, you just for all these guidelines. For example, this is the nutrition information management surveillance. I just explained about it. You can also answer the same, and for others. Management, this is the COVID. After that, we will be back to total partners. So you can see that how many partners you have, local NGOs partners, how many of them international NGOs, UN agencies, authorities, observer. Sometimes you don't have one of these things. You have donor, you can add donor also. So how you can add this one? If you have it, you just add it. If you don't have it, you click, you hide this one. Sure, that means it will be appear. So you will start local NGOs. I have this number. International NGOs, you have this number, and observer, whatever. You just add the number above, and the description, it will be ready from our side. Yes. So this is the reporting we finalize. So here we come up to things like useful link. So this is the useful link. You have it in your country and you want donors, or you want anyone visit your page and GNC website to see the useful link for this one. So for example, you can mention that we have more in this HR info. Also, you can mention the CCBM report. If you have CCBM report, you can add it. Financial tracking service. You can also explain your funding status, everything. You can add it from this one. Whatever useful link, you can add as many as you want. Country report, for example. So this is useful link. You just add the link and the description for the link. For this one, country report, you can add also. For example, sometimes you have bulletin, you have annual report, you have any report you want just to mention, you can add it here. This part, if you have it in the HR info, it is good. It will be synced automatic. You just write the name of the report. I prefer when you upload the report to the HR info or to GNC website, you mention the country. For example, you write South Sudan, so you can find it directly. You just copy paste the name and you will find it directly. But at least it contains the name of the country. It will be very good. And this is, you can add as many as you want. A country report. Now we come up to the key resource. The key resource we have, you can add just 5 key resources. So for example, CMAM guideline, IYCF guideline, assessment guideline. That means the important things for this country, the most important guidelines. You can add to 5. It will be displayed like this. This is the key resource. It will be displayed like this. So this is the most important things. You can see here, key resource. If you don't have, it is flexible. You just hide it. But it will be good that you mention if you have any guidelines. So other countries, they can get experience or exchange experience with your countries. If someone want to know IYCF guidelines from other country, they come to visit your country and see your guideline and report. If you have many reports, that more than 5, you can just add them as other resource. So you can also add other resource from your country. Here you will find other resource. You just add as many as you want report. Okay. So the last things, if you have, for example, some of you, they have information management officer, and they design a fantastic and good dashboard, interactive dashboard. You can just add it like this. So further to these figures above, you want them to have more details per district or sub-district. That's mean admin 2 or admin 3. It is very flexible. You just add your dashboard there. So how we can add these things? In iframe for dashboard, you just come to source and you paste your Tableau, Power BI, Google Data Studio dashboard to here, and it will be displayed directly in your page. So it is very flexible. Also, we have 2 things. This is just to show your country in GNC website. If you are L3 emergency, you just click. If you are country with an HRB or cluster, or sometimes you are not cluster, you are sector, you just mention. I will display for you these things. How is it? So here you just enter people in need, people target, people reach, funding request, and funding receive. You know, when you click here where we work, for example, this is the map. This is the information. It will be displayed once you click. For example, once I click like this, or for Yemen, you can see that this is the people in need, this is the people target, this is reach, this is the funding required, and this is received, and this to click. So if you, why we say that to add these things, L3 emergency or whatever. So if I want to filter just L3 emergency, it will show if your country, or just you want to know just the sectors, you know the sectors. It helps us to do the filtering. So this is the part, and me and Magnat also, we will support you if you have any question. Good. The last things you can find here, not here, I'm sorry. Yes, you can add media gallery. A lot of you, they have photos from the field for capacity building or for screening. So you can add your picture photo in your country profile. Also, if you have a video for your country, you can add. How you can add these things? You just click, choose the file from your PC, and you just upload it. If you have a video, you just add the video ID. But as I explained before, you can, in this guideline, you can see how you can add your video. For example, you can see this is the YouTube ID code. You just click share and add it. So this is in the guideline, you can find it. And you can add as many as you want video. Also, we have another guide, the same things I explained for you before I open it for discussion. Just a minute. Yes, in this, in the link I will share with you, it has all information about the same things I explained. What these things in the backend, how it will be displayed. So you can back to this one also to understand how you enter the information from the backend. So all this information, if you just back to our events in our website in the 15th, you click in the calendar 15th, you just click, you will find in the resource, the admin guideline, you download both of them and you will understand everything. And the video also, it will be here in the bottom. So yes, please, it is open for discussion. If you have any question regarding the how to submit your annual report. Yes, please.
Shabib, I think in the comment, thank you very much. And in the comment, we have Hashim, who is asking if they can upload the dashboard that is manually created through Adobe Illustrator. I think the response will be yes. And this once is uploaded to HRM4, so the link can be added under useful links, as you mentioned. Yeah.
Yes.
And another question is on PIN and target. So this coming from Anne, and they say like they have a revised PIN for both COVID, with COVID situation. And I leave this to you to respond. Yeah.
So they have revised one, yes, they can add the revised one, not the old one.
Good.
For the tutors.
So these are the two questions we have for now. I hope it's clear for other colleagues. Maybe they can, if any, there is Abin who want to say something. Yeah.
Yes, please.
Thank you, Shabib Bhai. This is Abid Hassan from Bangladesh Cox's Bazar.
Hi, Abid.
Yeah, just I want to know you after logging in, so I can see my 2019 report that I put for. So should I remove these and enter for 2020?
Yes, but just I want to mention for you, for example, just let me open. You can update it, and we will have a revision. We will have a save revision. For example, if you come here, just I want to mention one thing. Before it is saved, for example, as a draft, okay? And we will review. You have to mention here what you do. For example, if two people work, Abid and your Paco, the cluster coordinator, so you can tell him that I do, I update the figures, I update the links, so he work in the narrative things like situation analysis, COVID. So what is the good things? In the revision, we can know who do what. So you do this, I do this, you do this, and we can back if we need something. But yes, my answer, yes, you can remove the old 2019. We save it in our system, and you just start for mid-year 2020. Thanks.
Thank you.
Yes. Another question. If anyone don't have an account, just after this call, just please send us, my country is this one, and the username. For example, sometimes you are 2 or 3 for this country, you have IMO or you have someone to support you. Just let us know by email, and we will share with you the login details, how you can log in, everything. Thank you. Yes. I see a lot of silent.
No, there is one comment from Muhyiddin.
Yes,
if you can see in the chat box, say like a situation where initial pin and target and the separate one for COVID-19 exists, if both can be kept together.
Keep together. For GNC website, you can add one pin and target. So you cannot add both of them. But you can, for example, first of all, hi Muhyiddin, how are you? Second, yes, for example, in the situation analysis in the narrative report, yes, you can explain these things. But as a chart, just accept one figure. So it will be just one.
Another question is on reporting deadline.
Okay.
So can we
Anna, suppose you can start from now if your report is ready, if you have a login details. If you don't have, just contact me and Magnat, we will give it to you. The deadline, it will be, I think, until 5th of August. So we take in our consideration that countries finish the January to June reporting in between 15 to 20 July. So that means they can start reporting from today until 5th of August.
Shabib, can I say something?
Yes. How are you, Muhyiddin?
I'm good, good. Thanks a lot. It's been a while since we spoke.
Yes.
Yeah. Good afternoon, good morning, colleagues. This is Muhyiddin, UNICEF Chief of Nutrition, also, cluster lead or cluster, chair for DPRK. For us, Shabib, the problem actually we have is we are not actually, using HRP in Korea, DPRK. We have actually needs and priorities, which are kind of like similar to the HRP, but in our context, we also don't do HNO and stuff like that. So it's a little bit peculiar situation. Normally, in our implementation, we, mostly the implementation is done by the Ministry of Health. So we don't have NGO partners per se. The entire sector consists of mainly, 3 partners, 3 implementing partners. That's UNICEF, WFP, and one NGO, which is under the EU office. So in general, in the country, there are no mid-year sort of progress report as, with regards to the response plan. So I'm afraid that, we may not have this kind of the media reporting, because that is something also which has never been a practice in the DPRK. And normally there are these, the ND sort of reporting where, but now we are actually also kind of like, initially when the year started, we were planning as, the humanitarian community through the sectors with the help of OCHA to start, to set up a reporting, mechanisms and a reporting template. So even for the quarterly reporting for figures, because we even don't do monthly reporting to OCHA, we don't do even quarterly, but now we were actually in the process of kind of, agreeing the indicators and then, the frequency of reporting and all that. And so far, that has not yet been finalized because also, you know, the results monitoring group was not still fully established. I mean, even though they were there, but some of the members left. And again, also, I think the monitoring framework was never agreed and endorsed at country level. So per se, the monitoring of the response plan is much more, you know, through the sectors, but that is not consolidated, you know, through OCHA or through the RC office. So that is one also key challenge that we have in our context. And that, you know, the reason I'm raising is because we may not be able to have, you know, something to report or upload, you know, by the deadline. So, but anyway, we will monitor the situation. And now because more than 75% of, you know, the partners and international staff are out of the country, and we are scattered, you know, in different parts of the world. So very few people are actually, you know, in the country in DPRK. So that again adds, you know, adds to the challenge of not having even, you know, a regular monitoring or data to report. So these are some of the challenges we're facing, but anyway, we are monitoring and then we will update you in case we are able to report anything.
Sure. Thanks, Muhyiddin. Yes, we know that a lot of countries, they will not have most of this indicator, they will not have, but they can create the page and they can start with things they have. For example, your key contacts, if someone wants to contact you, challenge, response, this is narrative things, you can add it by yourself. Maybe you have funding, you don't have, yes, it is not mandatory to add everything. If it is not available, it is not available. And once it is, it have been available, for example, even after deadline, you can update it. So we can add it in other reporting. So it is not mandatory to fill everything, but at least if you have something you want to share with others, like other clusters, countries, donors, users want to visit this page, you just add it here and just mention whatever. Even if you go to this example, you will find a lot of countries, they have a different type of reporting. Some of them, for example, they don't have vitamin A. Some of them, they don't have micronutrient. So just report whatever you have.
Okay.
So thanks, Muhammad.
All right. Thanks a lot, Shabib. And sorry, I missed actually the first part of the presentation in terms of, you know, logging into the or creating the site. So I will follow later on the recordings, and then in case I have a question,
sure.
I will
share with you the recording, also the admin guideline.
Sure, sure. Thanks.
Other question? If there is no questions, so we can finalize this meeting. So you have save time, 15 minutes to do the reporting from now. I'm just kidding. So yes, there is nothing. So many thanks for everyone attending this call. Please try to contact us. Just send us your country, your name and email. If you have another member, for example, you want him to have access to this your country page, just let us know. So we will share with you the link and the login details just this week. So thank you very much, everyone. Really appreciate it and keep in touch.
Thank you, Shabib Bhai, Magnet, and colleagues.
Thanks. Bye.
Bye. Thank you.
Bye.
Thanks, guys. Bye.
Thank you.
Bye. Thank you, Shabib.